Hello students, welcome back. So in my last video I showed you one image and I asked you to diagnose that condition, and majority of you have given the correct answer. If you have missed that question, you can just click the I button above. I have given you the link. 40-year-old male presented with scales. So the lesions are very scaly over elbow and knees, so they are occurring over extensors that bleeds on removal. What is the diagnosis? Now this is something which is very important and very characteristic, that is the scaly lesions when rubbed they bleed. Okay, so this is known as which sign? Yes, they are talking about Auspit sign. So Auspit sign is a very important sign which is seen in cases of psoriasis. So answer here is psoriasis. And as all of you know that psoriatic lesions are erythematous plaque with silvery white scaling. So this is the characteristic silvery white scaling which is seen in these patients. Okay. Now Auspit sign is very important, and the points to remember in Auspit sign are that in this sign, when you want to elicit, we do three things. So first step is step 1, we remove all the scales. Okay, so removal of the scales. And in step 2, when you remove all the scales, you will find a shiny glistening membrane. So a membrane is seen. This membrane is known as Berkeley membrane. And once you remove this membrane also, that is the step 3, that is on removal of this membrane, you will find pinpoint bleeding spots. So this is Auspit sign, that is when you scrap the lesion of psoriasis with a glass slide, the end result is pinpoint bleeding spots. So this is known as Auspit sign. Now psoriasis is a pretty common condition, and the prevalence of this condition is around 1%. So there are many famous celebrities and famous persons which are suffering from this disease. Like you can see, this celebrity is suffering from psoriasis, and here you can see the erythematous lesion over extensors, because extensors are commonly involved and the lesions are erythematous with silvery white scaling. Similarly, one famous actress, that is Kim Kardashian, is also suffering from psoriasis, and here you can see her psoriatic lesions. Okay, so they are very common, and how you're going to identify them? Normally these are erythematous plaques with silvery white scaling, generally over extensors, but sometimes other sites may also get involved. Like you can see the lesions are present over face, or there is a type known as flexural or inverse psoriasis where flexures can also get involved, but in those cases the scaling is very less. Now this is the image for today, and you need to identify this condition. If you can identify this condition, just write your answer in the comment box below. Thank you very much.